Okay, as you know, keratoconus are generally present bilaterally, although it's sometimes very often present very asymmetrically. In certain very asymmetric ectasia cases, the contralateral eye may present full fruste keratoconus (FFKC) with subtle topographic characteristics that do not reach the threshold for keratoconus aspect. According to the global consensus on keratoconus and ectatic disease, true unilateral keratoconus does not exist. However, a unilateral clinical presentation may occur. This is from the global consensus paper. This is shown here is Pentacam Belin ABCD progression display, which Professor Belin introduced today already. This nice grading system gives us a lot of information about anterior and posterior corneal surface and the thickness pachymetry reading. We can follow up the data for long years. Using this program, we retrospectively investigated the corneal changes in the fellow eyes of very asymmetric ectasia cases. So we follow up the 24 eyes with VAE with normal topography over the 6 years. So this is the original plot for anterior radius of curvature, and this is the posterior radius of curvature and the thickness pachymetry. So as you see here, it looks like most of the parameters are stable, and it looks like there is no obvious keratoconus progression. So on the basis of tomographic evaluation, true unilateral ectasia can exist. Corneal Biomechanical Index (CBI), based on the corneal thickness profile and deformation parameters, are reported to be useful in discrimination of normal eyes and keratoconic eyes, and in detection of subclinical keratoconus. Furthermore, recently developed Tomographic Biomechanical Index (TBI), which combines Scheimpflug-based corneal tomography and biomechanics, can enhance ectasia detection. Actually, several papers from different countries reported that TBI is useful in detecting subclinical ectasia in eyes with normal topography in patients with very asymmetric ectasia from Brazil and Italy and Hong Kong, from Brazil and India and Germany. Okay, there are very, very recent papers. So we actually performed the TBI validation study in Japanese population. We enrolled 4 groups. So for normal eyes and keratoconic eyes and very asymmetric ectasia. In this group, actually we enrolled both eyes, ectatic eyes from VAE, actually VAE, and failed eyes of normal topography. VAE is in normal topography. In this, for the normality, for the inclusion criteria for normality is actually 0% similarity and 0% severity by the Kreis-Maeda or Kreis-Smith-Smorak display. We performed the Pentacam curves measurement for these cases. So here is a comparison result among the 4 groups. So this is BAD-D and CBI and TBI. Actually, CBI and TBI are indicated from 0 to 1, and so we converted BAD-D values to BAD-D DI, kind of index from indicating from 0 to 1. So it is easier to compare. So obviously, keratoconic eyes and ectatic eyes of VAE obviously shows a high value in BAD-DI and CBI and TBI. But if you look at the VAE with normal topography, So in the body, you can see values are here, and CBI, you can see some variation. Then also TBI compared with normal eyes, both CBI and TBI shows a kind of wide variations. I'd like to share with you some clinical cases. This is the ectatic eyes of VAE, case 1. So obviously you can see the ectatic ectasia. This is the fellow eyes of VAE, case 1. So this is a 40 years old female. And so you can see the 0% similarity and 0% severity based on the TMS5 display. And based on the previously reported cutoff value for VAD and CBI and TBI, so VAD and CBI are within the normal range, but TBI shows abnormality. So only the TBI detected abnormality. So in this case, it looks like subclinical ectasia was detected by TBI. This is another case of a VAE. So this is a 40 years old male. And this obviously you can see the ectasia in this eye. And this is the fellow eyes of this case. So obviously you can see the 0% for TMS5 display. And based on the cutoff value, if you look at the compared with these cutoff value and the real value, you can see VAD and CBI and TBI are all completely normal. So it looks like this case present true unilateral ectasia, not true fruste case. So we enrolled 23 eyes of VAE with normal topography. In 14 eyes, actually we detect abnormality at least one of the parameters. But in 19 eyes, all the 3 parameters shows normal. So as I mentioned today, actually in the so these VAE with normal topography showed it looks like there is no keratoconus progression for more than 6 years. But based on the TBI study, TBI can enhance the ectasia detection and may allow separation of true unilateral ectasia from true fruste cases. In summary, the integration of data observed in the TBI enhances the ability to detect abnormalities in most eyes with normal topography in very asymmetric ectasia cases. While keratoconus is defined as a bilateral disease, some very asymmetric ectasia normal topography cases may represent true unilateral ectasia, possibly related to external environmental factors such as eye rubbing or atopy. We need some more cases and some more longer-term follow-up. Thank you for your attention.